Hi everybody. We are now going to go through chapter 22, which is respiratory and gastrointestinal drugs. Respiratory drugs, respiratory diseases are common ones are asthma, COPD, and then upper respiratory tract infection. Asthma, chronic illness with periods of remission and acute exacerbation. 12 million Americans are affected, 2 to 5 million are children. Deaths are on the rise from asthma. My sister has a friend who passed away of asthma at, I want to say she was 9 years old. So, very sad and preventable. Signs and symptoms are coughing, especially when there's a wheezing with it. Increased sputum production, shortness of breath, and chest tightening. The cause is the bronchoconstriction that's caused by hypersensitivities of the airways, resulting in a reversible airway obstruction from inflammation. They can be induced by exercise, by cold, humidity, environmental irritants, chemicals, stress, cold weather, allergens, pulmonary infections, and medications, especially aspirin and NSAIDs. That's why we don't recommend aspirin for the asthmatic patient. COPD, the chronic obstructive pulmonary disease, affects more than 11 million Americans, so you guys can kind of see the amount of people with respiratory disease is pretty high, so you will see these. Effects characterized by irreversible airway obstruction with either chronic bronchitis or emphysema. 80 to 90% are due to cigarette smoking and pollution and occupational irritants. Bronchitis is a chronic inflammation with excessive sputum. Cough with sputum production on most days for 3 months of a year for 2 consecutive years. So not fun. Emphysema is due to the destruction of the alveoli with air space enlargement and airway collapse. Sorry everybody, that's my daughter. Emphysema is due, we just went over that. COPD and asthma, the dental concerns. Asthma, make sure the patient has their inhaler and you want to make sure that you set it out on the counter. If my patients have COPD or asthma and they don't have their inhaler with, and they've had one fairly recently, an attack fairly recently, I just go and grab it out of the emergency kit and leave a note of which room it's in. And COPD, these patients can develop pulmonary hypertension, increase in blood pressure, and this can be caused from the stress. So avoid stressful situations, schedule short appointments, and in the morning. Status asthmaticus is persistent life-threatening bronchospasms despite drug therapy. Very serious, very scary situation. So for treatment of these, we use the corticosteroids that we've gone over. Oral, IV, and oral inhalation are the ways that it can be delivered. They inhibit airway and responsiveness of the beta 2 receptors. Sorry about that. Used for maintenance therapy. This is where we use the Advair discus. Okay. Adverse reactions, not as severe as with oral tablet steroids, but usually are limited to the oropharyngeal region, hoarseness and dry mouth, and cough. Dental concerns, examine the patient for oral candidiasis. Again, they're supposed to be rinsing with water after they have to use their their albuterol.
I will use water too.
Yeah, you use water too. And then counsel them on xerostomia. And then you can see the names.
Mom,
You can see the names of the drugs here.
Mom, let me see
Sorry,
water.
I can't pause this. Go upstairs, my daddy.
I don't want to go to bed.
Beta adrenergic agonists are sympathomimetic, so they mimic the parasympathetic system. They're used to treat acute asthma and COPD. So, look at the bottom here. You can see which ones they are. They're generally the inhalers, the albuterol inhalers. Therapeutic effects: it relaxes the airway smooth muscle and increases ciliary movement. It also has an effect on the mast cells. Of course, that's the asthmatic reaction. Nonspecific beta blockers affect B1 and B2 receptors. Examples include epinephrine and isoproterenol. Specific B2 adrenergic agonists are used for acute asthma attacks. The adverse reaction of those is nervousness, tachycardia, insomnia. The dental concerns: check the blood pressure before administering any anesthetic, assess for dry mouth, and rinse after each use. The names...
Cover my mouth.
Oh, sorry about that. The names end in all, so not olol, but all. Treatments: anti-inflammatory agents, the inhalers. You can kind of go through this. I believe this was mainly covered already. Adverse reaction: bronchospasms, wheezing, and coughing. The dental concerns: again, rinse mouth after each use. Anticholinergic agents work on the parasympathetic system, and they are for bronchodilation and to avoid the block reflex of bronchoconstriction. Used for maintenance therapy of asthma, emphysema, and chronic bronchitis, mostly in the cold air or humid. 2 puffs every 6 hours. Adverse reactions are dry mouth and a bad taste. I believe this has a metal taste. Dental concerns: you want to counsel the patient again about rinsing after each use. And here's the name of Atrovent. Over-the-counter cold medications: always ask about over-the-counter drugs because they can still have an effect on the oral cavity. Especially now, a lot of allergy meds are over-the-counter. Nasal decongestives like the pseudoephedrine, the expectorants, antitussives, and mucolytics. Nasal decongestives, the pseudoephedrine, constrict the blood vessels of the nasal passages, available as oral tablets, capsules, liquids, and nasal sprays. More than 3 days of nasal spray use can cause a rebound of the nasal congestion. So you want to make sure your patients aren't using it over 3 days without having a doctor be evaluating them. Expectorants decrease the sputum and the viscosity and promote the rate of exudate from the respiratory.
I'll be right back.
Antitussives provide symptomatic relief from dry, non-productive coughs. Both opioid and non-opioid antitussives cause CNS depressant of the cough center in the brain. Codeine is the most effective antitussive agent. Codeine alone is hard to find. A lot of pharmacies don't carry it much anymore. It's usually mixed with something. Methorphan is an antitussive medication used in most of the over-the-counter cough suppressants. Mucolytics, the enzymes are able to digest mucus and decrease its viscosity. So it loosens the chest congestion. We like that, right? And then you can see here a peptic ulcer. They are no fun. So now we're getting into the GI system. And so one thing that can cause an ulcer is overuse of aspirin. Gastrointestinal drugs, peptic ulcer disease, aching or boring epigastria pain that is relieved by food or antacids, caused by the bacteria H. pylori. Pain may radiate to the back or chest and can wake the person up from a sound sleep. NSAIDs are a risk factor for the peptic ulcers. The treatment is antacids or proton pump inhibitors and H2 receptor antagonists. Treatment of the ulcers is aluminum magnesium hydroxides or antacids such as Maalox and Mylanta. Sometimes these will be in an oral rinse also just to even the pH in the mouth for like burning mouth syndrome. Aluminum salts cause constipation. Magnesium salts cause diarrhea. Together they are partially neutralize hydrochloric acid in the stomach. They raise the stomach pH. So that would be nice. Calcium carbonate antacids, such as Tums, they neutralize the acids, but they can cause kidney stones and constipation. Sodium bicarbonate antacids, such as baking soda, rapidly reduces the acid in the stomach and it's absorbed by the body. Too much salt and too much acid.
And you had a sir.
Treatment for peptic ulcers, you can get the Tegament, Pepcid, the safest, most tolerable, and most effective therapy for the ulcers is the Tegament and Pepcid Zantac. They block the binding of the histamine, which decreases gastric acid. Adverse reactions are very rare, but they can get a headache, lethargy, confusion, and they do all occur more frequently with the Tegament than the Zantac or the Pepcid.
Mommy.
If they are having, Tegament can also increase blood levels of warfarin, lidocaine, metronidazole, phenytoin, and diazepam. So you've seen Tegament kind of throughout the book, but I don't know if anybody really picked up on what it was alluding to, but here it is in our GI section. And it reduces the dose. You must reduce the dose in the elderly and in children. And then you can't take it at the same time as antacids. You have to wait 2 hours before you take an antacid. Treatment for ulcers using the proton pump inhibitors. This is the newest class of drugs to treat ulcers. And you'll see that omeprazole, the Nexium, you can see Losec. I'm just going to use the brand names because we're probably a little more familiar with those. The only ones that the patients are more familiar with is omeprazole that I've seen on the health history. Otherwise, they write Prevacid or Nexium. Reduces gastric acid secretion and used to treat active duodenal ulcers, erosive esophagitis, and also used to treat GERD. Adverse reactions, they'll have abdominal pain, headaches, esophageal candidiasis, mucosal atrophy of the tongue, and xerostomia. So treatment of the of the H. pylori antibiotics, Pepto-Bismol is considered an Pepto-Bismol antibiotic, sorry. Flagyl tetracycline and amoxicillin can also be used. And it is a gram-negative bacteria. This is all fairly new still, the H. pylori, and treating it with antibiotics. The bacteria does increase with age, so people become more susceptible. And it's more common in socioeconomically deprived patients. You can kind of see the route of action here, the gastric reflux action. Very uncomfortable. GERD, the gastrointestinal disease, is known as heartburn, where you get a backflow of the acid up into the esophagus. Irritation, inflammation, erosion of the esophagus. It can be interpreted as a heart attack, and symptoms aggravated by large meals and assuming a supine position. So, very scary for some people. The treatment is to decrease the acid in the stomach, to constrict the cardiac sphincter. H2 blockers and proton pump inhibitors are used to reduce or eliminate the stomach's acid. Lifestyle changes that you can see or that would be beneficial is elevating the head of the bed, avoiding alcohol, tobacco, and fatty foods, greasy foods. Sometimes both approaches are utilized, and dental concerns don't lay the patient completely back in the chair, and then recommend anything that can help prevent xerostomia. Also, you want these patients, their mouth is usually a little more acidic, so you want them to, be rinsing with water. But also you may notice some erosion in the oral cavity from their GERD. Reglan stimulates the motility of the upper GI without stimulating secretions. It relaxes the sphincter and increases the muscle contractions in the duodenum and to accelerate gastric emptying. It blocks dopamine, which can cause the Parkinson's-like reactions. Also causes sedation. So when it's causing sedation, it's probably passing the blood-brain barrier and causing CNS depression. Propulsid is the newest medication, and it doesn't block dopamine and has less side effects. With both drugs accelerating gastric emptying, they may affect the absorption of other drugs, so that's important to keep in mind. The patient would probably want to consult a physician about when to take, or a pharmacist, about when to take their other medications so they aren't interrupted. Constipation is a decrease in fecal elimination. Normal frequency varies from person to person, 3 times a day to 3 times a week. Laxatives should be used only for a short-term basis. Factors that influence constipation is poor bowel habits and inadequate fluid intake. So if a patient's talking to you about this, definitely recommend that they're getting their 8 glasses of water in a day. Anticholinergics can slow it down, inadequate fiber intake, narcotics. Remember when we were talking about opioids, a lot of them caused constipation, and then stress. The treatment of bulk laxatives, they absorb and retain water and increase the fecal mass. Stool softeners and lubricants absorb water into the intestines. Long-term lubricants, such as mineral oil, are no longer recommended because they interfere with the absorption of fat-soluble vitamins. So very important. Saline laxatives and organic salts used before surgery. Hypersmotic laxatives, glycerin suppository.
Mom, can't tap the water.
And stimulant laxatives increase propulsive activity of the intestines by local irritation of the mucosa used before surgery. Diarrhea is increased GI motility, so this is just the opposite, and can be acute or chronic. Acute usually is caused by an infection, a medication, diet, or toxins. Chronic can be a result of the organ pathology, so they would want to go in for a scope. Shh, Mommy's talking. This can lead to dehydration and an imbalance in the electrolytes. The treatments are used to minimize fluid loss. Opioids are among the most commonly used antidiarrheal medications. Absorbents are used to absorb the causative bacteria like kaolin and pectin. And then adverse reactions, of course, they're eliminating a lot of water, so you'll see a dry mouth. And opioid antidiarrheals are sedating. Again, depressing the CNS. Emetics and antiemetics. Emetics cause vomiting. They're used to treat drug overdose, abused by people with bulimia. An example is Ipecac syrup. Antiemetics are used to control nausea and vomiting, and are the drugs of choice of drugs depends on the cause of vomiting, such as pregnancy, or if it's another drug, you know, if it's chemotherapy or what that they're needing it for. Antiemetics are anticholinergic meds, antipsychotic meds. Sorry, my daughter's sitting here. Cannabinoids are used to treat nausea and vomiting in chemotherapy patients. And then the adverse reaction of antiemetics is dry mouth and sedation. Chronic inflammatory bowel disease, ulcerative colitis, involves only mucosal or open sores. It involves the rectum and doesn't involve small intestines. Crohn's disease, you'll see this on a lot of patients' health histories, affects all layers of the intestinal wall. They all are inflamed and can involve the entire intestine. Colon is the most affected. Can cause ulcers in the mouth. So that's, of course, something we would want to know. And classified as an autoimmune disease where the body attacks the GI tract. Treatment of chronic anti-inflammatory bowel disease is steroids, immune modifiers, and antibiotics. NSAIDs should be used with caution in patients with IBD. All right, well, thank you for putting up with this video. I apologize for the interruptions, but if you have any questions, please let me know. I feel like this was covered pretty well in class with the other presentations, so I will put those on the site here tonight. I'm going to update everybody's PowerPoint so you guys can read through them. Okay, thank you very much.